Folks, in this module, I'm going to walk you through cardiopulmonary resuscitation, aka CPR, for an adult casualty. So again, I'm going to be approaching my scene, checking for dangers. Are there any dangers to me, dangers to anybody else? Am I better off withdrawing but calling the emergency services? After establishing it's safe, I'm going to see if I can get a tangible response from my casualty. Talk to them, ask them questions. Do they know where they are? Can they respond to my commands? If there's no response to my voice, I'm going to pat them gently on the shoulders, try to physically get a response out of them. I'm then going to perform a chin lift, open the casualty's airway, look, listen and feel for breathing for 10 seconds. 10 seconds is long enough to ascertain either normal breathing or other. Remembering, of course, if I am happy that my casualty is breathing normally, I am going to pop them on the side into the recovery position whilst I await my ambulance. If after 10 seconds I am not 100% satisfied that breathing is normal, I am now going to commence CPR. What I want to do is either 999, put my phone on speaker, relay to the operator what's happening, or speak to a bystander. I want to get the following points across. I'm dealing with a casualty. They are not responding to me. I am not satisfied with the breathing. I'm going to begin CPR, and I want to try and ask that same person or somebody else to bring me a defibrillator or AED. Now, what I want to start with are chest compressions. I want to get the small amount of oxygen that's going to be in this casualty's blood from their last breath circulating around the body as quickly as possible. I want to keep the brain alive. Remember, CPR is not about making them recover, it's about trying to prevent further damage until the emergency services arrive. So I'm going to place one hand and then another hand with interlinked fingers in the center of the casualty's chest, between the nipples and about a centimetre or two below. Just remember, two hands, center of the chest. I want to stay up nice and straight, and I'm going to use my body weight to drive down into the casualty's chest. I would urge you, don't do chest compressions with bent elbows because that's just going to get really tiring. Use your body weight to drive down into the casualty's chest. You should press down about 5 to 6 centimeters off the chest cavity. From me to you, just press hard. Any form of chest compression is far preferable to no chest compressions. I want to give 30 chest compressions. Don't sweat the small stuff if you go slightly over, but about 30. I want to do them at a rate of just under 2 per second. Now, if this helps you, think of the songs Staying Alive, Nelly the Elephant, Baby Shark, incidentally, and a very strange choice, Another One Bites the Dust. They are the correct tempo to give chest compressions. When I have done my 30 chest compressions, I want to retilt my casualty's head backwards, pinch their nose, place my lips around theirs, and I want to breathe for them. Normal breaths. 1, 2. I want to see their chest rising and falling. When I've placed in my 2 rescue breaths, I now want to circulate that oxygen around the body by going back to the chest compressions. I'm going to continue this at a rate of 30 compressions to 2 breaths. 30 to 2, 30 to 2, until there is a significant sign of recovery. For example, my casualty opening their eyes, coughing, spluttering, starting to vomit, in which case I'll roll them on their side or asking what's going on. When a paramedic arrives and they specifically tell me to stop, never cease CPR because you can see sirens in a distance. Wait for them to come to you and to talk to you. If it becomes physically unsafe, there's a threat, there's a change in environmental circumstances, or I become ill, injured or fatigued, if you have to stop, stop. Don't beat yourself up about it. You've still done something. We'll also stop when the defibrillator arrives. We turn it on and it instructs us to do so.